everyone, welcome to another episode of The Doctor's Talk. Myself, Dr. Sri Lakshmi B. Today, I am truly happy to have with us Dr. Sunil Kumar, Vice Principal, Professor and HOD, Department of Kai Chikitsa, Ahalia Wellness Medical College and Hospitals. Welcome to the show, sir. Today, we are dealing with the topic stroke, a serious condition that needs timely attention and awareness. Sir, could you please explain what is stroke?
First of all, stroke is a medical emergency. So mainly stroke is classified into two types. The first one is ischemic stroke and next one is hemorrhagic stroke. So ischemic stroke is nothing but when blood supply to the brain is disrupted or blocked due to a clot or any fatty deposit. So what will happen is that blood supply to the brain will be disrupted. So the brain won't get oxygen and nutrients. So the stroke is occurring. And second one is hemorrhagic stroke. Hemorrhagic stroke is nothing but it is a rupture of the blood vessels within the brain. That is called internal bleeding. So compared to these two strokes, actually, a hemorrhagic stroke is a little bit fatal.
Sir, what are the causes of stroke?
See, ultimately, for not maintaining healthy lifestyle is the ultimate causative factor for stroke actually. Because the patients who are having hypertension, patients who are having diabetes, having cholesterol, all having the contributory factor for stroke. So stroke is always not maintaining healthy lifestyle. And ultimately, another causative factor for stroke is that about anxiety, stress and depression. Because nowadays on the busy world, no one is share his or her feelings to any close ones, any friends or relatives, nothing. So what happens because of stress level increase, so many patients are also getting the stroke. So the physical and mental factors both contribute the factor for stroke.
Sir, who are the people at risk for stroke?
See, the higher risk for stroke can occur for anyone. It can occur for infants also. It can occur for even for adults also. So mainly it is affecting for the old age ones. But still nowadays we are seeing around at the age of 30 years also, at 40 years also, there's so many persons are getting the stroke nowadays. So we can't predict the risk factors, but this is about the age factor. And about the disease factor, as I told before that about the lifestyle disease like cholesterol and blood pressure and diabetes, these patients will be getting prone. Means they are very much contributing factor for stroke.
Since stroke symptoms often happen all of a sudden, sir, could you please tell us what the common warning signs are?
See, majority of the patients won't see the signs and symptoms before, but some patients, they will realize the signs. Some patients, they tell that they will get severe headache, without a known cause. And afterwards, they will suddenly faint. Some patients. But other persons, actually, they feel that before getting signs means they will feel about body imbalancing. Body imbalancing they will feel. And some about blurred vision. They won't see the objects clearly. There's a blurred vision will come. And some of the face, about the weakness of the face, means face or the drooping of the face. And some of the weakness of the arms. Sometimes weakness of the half side only. Sometimes we'll feel like that. And slurred speech, because whenever they speak, it won't get clarity. They won't have any clarity for the words. So like that happened. And all these factors about these warning signs. And about National Stroke Association, they call acronym that FAST. FAST means that F means face. So ask the patient to smile. So at the time what happened, one side of the face will be drop up. And about arms they're telling about ask the patient to raise both the arms. Then they can't pick in the arms. They'll feel severe weakness. And about the speech, they will tell some words also, because they will ask the patient to tell some words or any sentence. They can't utter the word. So like that we can. And at the time, it is a fast means it's the time to call ambulance or time to call 911. Approach the hospital very soon.
Are there any preventive measures or lifestyle changes that can help to reduce the risk for stroke?
Actually, for reducing the stroke, again I told before, for maintaining healthy lifestyle only actually. That's a ultimate prevention for that one. So we'll tell that so start to exercise regularly and start to eat a healthy meal, healthy snacks. And if the patient is a chronic smoker, then ask the patient to stop smoking immediately, because it will cause damage to blood vessels. And again the same policy about the even the patient is alcoholic, patient is consuming alcohol, then you tell excessive alcohol also consumption is increasing the blood pressure, so we'll have to stop the alcohol taking. So like that we can advise healthy lifestyle, and for stress relief and all we can have so many meditations like that and all, yoga, etc.
Sir, from an Ayurvedic point of view, could you please share how stroke is managed?
Yes, exactly. Actually, Ayurvedic treatment gives tremendous results. Actually, okay. The ultimate aim for the Ayurvedic treatment here is that we are getting for physical rehabilitation, because while getting the stroke, the half part of the body is paralyzed. Sometimes the full part of the body is paralyzed. So ultimately, we have to get about physical rehabilitation. So for that, we are having the massage therapy, where Abhyanga will tell the complete massaging with the medicated oils. It will give, it improves the strengthening of the body and improves the stabilization of the body. Okay. And next one is about the powdery massage. Again, it improves the strengthening and stabilization. And pouring the medicated oils to the nostrils, that's called nasya. It gives a strengthening and revitalizing the brain. Okay. And and about pre-chill, some type of treatment is that pouring medicated oils from the particular distance to the body, and it also improves the strengthening and functioning of the body. So almost all these therapies will give the strengthening and functioning and stabilization of the body. So that is ultimate aim for after getting stroke we have to do. And there are so many herbal preparations and mineral preparations also we are having for the fruitful results. So ultimately, while approaching the patient after the emergency management, the patient is coming to the hospital, we are having very good and beautiful treatments will give the ultimate results.
That's the end of today's session. Thank you for your valuable insights, sir. Thank you for watching.
Ahalia Wellness, the future of Ayurveda.